The SURPASS-ET study was a randomized phase 3 study of ropegulated interferon alfa-2b versus anagrelide in the second-line setting for patients with essential thrombocythemia. And we had previously showed the top-line data demonstrating ability of ropegulated interferon superior to anagrelide for better control of the platelet count, a further impact on the molecular response in the disease, favorability in terms of thromboembolic events. So it was a very positive phase 3 study. What my colleague Dr. Gill presents at this year's EHA meeting is kind of the next step. So this was a randomized trial through year 1, and then in year 2, patients that had been on the anagrelide arm were then allowed to cross over onto the ropegulated arm, which really gave us an additional set of information. Patients that started on ropeg from kind of the enrollment in the study versus those that really started after a year of anagrelide first. And what that demonstrates was really superior outcomes. First, in terms of ability to control the platelet count and other aspects of the disease. But second, that there was a clear favorability in terms of the molecular response. We hope that patients that cross over later will eventually achieve molecular response, but at best that is delayed and certainly is kind of diminished in comparison. So I view that, what these data continue to tell us that ropegulated interferon is both more effective in that kind of short-term lens of efficacy, platelet count control, tolerability, lack of hemorrhagic events, but also that there is this aspect of better molecular control that we feel will probably have a deeper impact for the longer term, and hopefully will, again, as we follow these patients out longer and longer, will show less progression to myelofibrosis or other secondary aspects, which very much would match what we have seen in polycythemia vera, where the use of ropegulated interferon earlier in the course of the disease probably makes a difference in terms of that progression-free survival.